first project that we worked on focused on what we called adaptive licensing. This is a project that we did in close collaboration with the European Medicines Agency, which is the equivalent of the FDA for Europe. In the adaptive licensing project, what we were focused on was trying to enhance the flexibility of decision-making for regulators. So that would be moving from the traditional model of regulatory decision-making, which is a binary go, no-go model of decision-making at a single point in time in the life cycle of a product, and a one-size-fits-all approval of that product for a disease. And at that point in time, when a product rolls out into the market under the traditional model, most of the formal learning about that product stops. So there remain a lot of questions that we can't really answer about how to optimize the use of that product in the real-world setting. The adaptive licensing model that we looked at offers a different way of doing decision-making, and that is more of a progressive reduction of uncertainty about the product over the life cycle. It involves a staged rollout of that product to different subpopulations of patients with a disease, depending upon the benefit-risk profile of that patient as it relates to that product. And as the product is rolled out to these subpopulations, there's a much more aggressive and continuous collection of evidence to continue reducing uncertainty about how to optimize the use of that product in the real-world setting. So that was what we looked at in adaptive licensing. This was a model that we did not come up with, we did not invent this, but it was a model that had been talked about for a number of years by a number of regulatory groups around the world. It had just never moved from an idea into action. And we decided we wanted to see if in New Digs we could actually advance that, evaluate that, and see if that model might actually have some plausibility and value to it. There was a lot of skepticism about whether we were going to be able to make any progress with this. People told us it was a very, very complex undertaking to look at regulatory decision-making, especially if you're looking at it not just with regulators, but with all of the stakeholders in the room. We were very pleased because there was a very successful outcome, I think on two levels for that project. First of all, after 3 years of working together with our collaborator community and 13 case studies, as I described before, the European Medicines Agency launched a European-wide pilot project to further evaluate that paradigm in the real-world setting, in action. That pilot project was completed in 2016. It was viewed as successful, and that paradigm, which we had called adaptive licensing, lives on and is continuing to evolve and be refined under the name of adaptive pathways in Europe. The other level on which that project was very successful and important to us in New Digs is that we learned a lot from it, and we could see that there were many valuable principles that we discovered through that work. These are principles that are important not just for regulators in their decision making and not just in Europe, but in terms of, again, how we want to help the system catch up with the science, that there were many principles that we gained insights into, which we are now applying in a much broader way. It provides us with a broad strategic framework for all of our work in New Digs and for a shared vision for how all of the stakeholders can evolve the system together to catch up with the science. Adaptive licensing continues to live on in our work in New Digs, but under a much broader name, which is now called Adaptive Biomedical Innovation, which provides us with a broad strategic framework for the evolution of the system, which needs to really be contextualized, tailored to each geographic region. So the principles are the same across the global industry, but how it is actually designed and implemented will look different in different geographic regions around the world. Adaptive Pathways was tailored for Europe, but it'll look different in the United States, and it'll look different in Canada and Asia. So we thought it was very important, rather than focusing on the differences across the regions, to see the commonalities so that we could all be striving for a shared vision and that we could coordinate and harmonize as we go as much as possible instead of after the fact. So this is all happening under the umbrella term of adaptive biomedical innovation.